Outcomes of anterior versus posterior peroral endoscopic myotomy 2 years post-procedure. Prospective follow-up results from a randomized clinical trial. Introduction. Peroral endoscopic myotomy, POEM, is currently a well-established treatment for achalasia and has become a first-line management option at many high-volume centers. Clinical and technical outcomes are comparable to conventional laparoscopic Heller myotomy. The procedure utilizes submucosal tunneling to access the lower esophageal sphincter and is essentially the endoscopic equivalent of surgical myotomy. The myotomy can be performed in an anterior or posterior orientation, which corresponds to the transaction of muscle fibers at 1 to 2 o'clock versus 5 to 6 o'clock positions, respectively. Theoretically, the anterior approach limits pathologic reflux as it preserves the oblique fibers of the lower esophageal sphincter, whereas the posterior approach minimizes bleeding risk as it avoids major branches of the left gastric artery within the anterior submucosa. In current clinical practice, myotomy orientation is largely driven by operator preference. In recent years, several studies have focused on comparing the two approaches, revealing similar efficacy and possibly lower risk of post-POEM gastroesophageal reflux with the posterior approach. However, the limitation remains the lack of longitudinal data, as all comparative studies reported outcomes with a follow-up of less than 12 months. The authors previously conducted a randomized clinical trial, RCT, of 150 patients to compare the two approaches and showed that the posterior approach was non-inferior to the anterior approach, with no difference in clinical response, adverse events, or pathologic reflux at 1-year follow-up. Comparative outcomes of both approaches during long-term follow-up are not currently known and are of clinical interest. The primary aim of the current study was to prospectively follow up a controlled, randomized cohort for at least 24 months post-POEM. Background. POEM is considered a primary treatment modality for achalasia. It can be performed using either the anterior or posterior approach. A previous RCT showed that the posterior approach was non-inferior to the anterior approach at 1 year post-POEM in terms of clinical success, rate of adverse events, and risk of gastroesophageal reflux disease, GERD. The aim of this post-RCT study was to compare outcomes at 2 years or more post-POEM. Methods. Patients who previously completed the 1-year follow-up were contacted and their Eckhard dysphagia and GERD questionnaire, GerdQ, scores, and frequency of proton pump inhibitor use were recorded. Clinical success was defined as an Eckhard score less than 3. Results. 150 patients were initially randomized and 138 completed the 1-year follow-up. Of the 138, 111 also completed 2 or more years of follow-up, with an overall clinical success decrease from 89% to 82%. At 2 years or more post-POEM, clinical success was achieved in 85% and 79% in the anterior and posterior groups, respectively. A similar decrease in clinical success was noted in both groups at 2 or more years. The GerdQ score was 6 in both treatment groups. Conclusions. The anterior and posterior POEM techniques remained equally effective at 2 years, and decreases in efficacy were similar between the two approaches over time. GERD outcomes were also similar in both groups during medium-term follow-up.